Hello, my name is Dr. Jared. I'm a physical therapist and lead physical therapist with Theranos. I'm here to chat with you about how to make a proper, good first impression on your virtual appointments. So, in virtual care, the session doesn't start when you begin speaking. It starts the moment the patient sees you on the screen. And in those first few moments, the patient's already deciding whether they trust you, whether they think that you're really focused on them, whether they think you care, and whether they think this is going to be worth their time at all. So um, typically, though, most clinicians just go straight into the session. They log in, adjust something quickly, and start talking. There's usually no intentional setup for how they appear on screen. Camera angles are inconsistent, lighting is whatever happens to be there, eye contact is unintentional, clothing is often overly casual, and distractions happen without realizing it. Over time, this has kind of become the standard. As long as the session starts and the clinical work gets done, we assume that's enough. But virtual care does not work that way. Because unlike in-person care, the patient doesn't have a clinic to rely on. There's no room, no physical presence, no environmental cues, no smiling reception desk. And that changes what we have to do in virtual. The problem is, virtual is amplified. The first impression that you make is really, really amplified. A slightly distracted look feels like disinterest. Poor lighting feels unprofessional. Looking off screen feels like you're not fully present. Overly casual clothing can signal a lack of professionalism. And all of this happens before you've said a word, and certainly before you've said any clinical related words. So by the time you start explaining anything, the patient has already decided how engaged they're going to be and whether they're going to come back. So instead of treating virtual care like an extension of in-person care, we need to treat it as its own skill. And it starts with how you show up. A strong first impression in virtual care is intentional. Camera is positioned at eye level, so it feels like direct eye contact. Lighting is clear, so your face is visible. Your background is clean. It's not distracting. You can use a virtual background. Your posture is upright and engaged, not leaning back and disengaged. Your audio is clear. Your video is clear. Your clothing is professional, consistent with our clinical setting would be. So, like collared shirts, polos, button ups are a simple standard. I like to wear my school issued quarter zip. So business casual attire is appropriate, and a lab coat, if you want to, you can use that too. That really can help. But avoid overly casual clothing as it directly affects how they perceive you. Like wearing scrubs, hoodie, even sometimes wearing a crew neck sweatshirt. It really doesn't come across that great. And in the clinic, I've seen that a lot of times in different travel positions and whatnot, and it seems to flow well. It seems all right. But when you jump on a call as a patient and you get that first see at your therapist and they're wearing a hoodie or something, it's not, it doesn't feel the same. So we have to set that bar a bit higher. Other things, you want to make sure you're looking kind of at the camera when you're speaking, or at least at the screen. And make sure there's no distractions. You're not multitasking in that first impression, no divided attention during your first impression. So you don't want to be busy documenting the whole time as you're greeting your patient. Because in virtual care, your attention is pretty obvious, it's visible. This might seem simple, but it fundamentally changes how the session feels. Because before you build trust, before you explain anything, before you guide care, the patient has already decided how they feel about it, how likely they're going to come back, whether they think you're going to actually help them, and so on. And that shapes everything that follows. Thank you.